I'm Dr. Emmy Le Nur, and I have been with Progressive since 2011. I am a general dentist practicing here in Garden Grove, California, and I graduated from UCLA, and I was lucky enough to start with Progressive right away. And so I graduated 2011, and shortly after that started with the instructor series and became an instructor in 2013. I'm a general dentist, but I very much have a love for orthodontics. I started so early. I've been doing it for so long now, and I really have an affinity towards it. So I have a lot of patients that see me as the orthodontist, but the good part is that I am also a general, so I can work that into making a full treatment plan for them. Well, in my practice, I do a lot of fixed as well as aligners, right? So I started with fixed, got very busy with that, and then realized that my patients were asking about aligners a lot more, and so I got into that. But really my core patient group probably is fixed orthodontics. But having that background, I'm able to make very good decisions, help my patients decide between doing fixed or aligners. So now it's probably 50-50 to tell you the truth, just because if that's people are wanting it. But I feel really good in my practice that I can offer both services. And so when I'm teaching the doctors in the courses, the cases, I love to go through cases basically. So because that's what I do all day long. Like I'm seeing patients, just like a busy orthodontic practice, we have 3 or 4 per hour. So it's very, very active, and so we're problem solving all the time. And so when we're in the seminars, I love going through the cases because we present the case and then we follow it through to see what happens, right? Just like in real practice. So the next month they come in, they present like this, what are you gonna do? So I love to talk about that, how to attack, what you need to do for that patient that day, how to troubleshoot, things like that. And it's the same whether you're doing fixed or aligners. You still have to be on your feet and thinking about what's the next step, whether your case is going the way that you want it to go, or is the case tracking, things like that. So that's probably what I love the most about the seminars. It is hard to say. Part of it depends on the hands of the doctor too. I'm super comfortable with fixed and I know I'm really good at it and I know it can be very efficient in my hands, right? And so sometimes I will push them more towards that, but then some cases I just think it would be wonderful with aligners and they really want it, so we go that way. So that's why I say 50-50, even though I would look at the numbers and it may be skew one way or the other, but there's just so many little small factors, so little small things that you have to interview the patient, so that initial consultation is so important because that's when you're gathering information about their lifestyle, what their wants are, what their motivations are they in a huge time crunch, right? Mm-hmm. So it's just, has to be a very open relationship between the doctor and the patient, and you really just have to talk, and so my consultations will always last, 30 minutes or something like that, right, before the staff comes in and starts taking all the records, because you just want to make that good decision in the beginning. Compliance is a huge issue no matter for any ortho, and it is sometimes hard to gauge, but there are, that is the benefit of being a general dentist because you really know your patient. Who knows the patient better than the general dentist? The person that's doing hygiene, doing the exams, right? And you know them because they've been in your practice, you know their family, you know their habits, you know their home habits, right? So you know if they're going to be a good ortho patient or not, right? I mean, of course, lifestyle things can happen and travel happens and things like that, but you want to be able to gauge that ahead of time before you even get them started. So with aligners, yes, you have to be very compliant because yes, you have to keep things, it's easy to keep your teeth clean because you can take your aligners out. You have to put them back in for 22 hours of the day. But with the fixed braces, you have to keep everything clean, super clean. And so I've had, 12-year-olds that have major decalcification around their brackets because they're not keeping things clean and they're too old for their parents to pin them down to clean their teeth, right? So compliance either way. I mean, sometimes I find like I have more success with the aligner patients with compliance versus the young ones where the parents just want me to slap the braces on, and maybe we should have waited till they're a little more mature, right? And that they know how to clean their teeth and all that. So, red flags are parents that don't bring them every 6 months, people that miss their appointments, or they schedule appointments and they break them, or they come in and they're not doing what you asked them to do from the last hygiene appointment, you know, things like that. So we are very busy here, so I do try to screen the patients too, you know, like if the parents come in and they say they want their child or their teen to have, you know, ortho, but the kid won't look you in the eye, the kid doesn't talk to you, they don't clean their teeth, and they're totally unmotivated, they don't want braces, you know, their friends have it and they hate how, you know, they say they hate them too. Is that the patient that you want to start the braces on, right? So maybe not, maybe we wait for them to mature. But luckily, because you're the general dentist and you have an eye for ortho, every 6 months you're seeing them. And so you can talk, and people change. Adults change too. You know, the lifestyle changes. They get to different places in their life where this can be a possibility, and I'm ready for this. When we have ortho patients coming in, for example, Friday afternoons are really busy, Saturday mornings, yes, I have to work some Saturday mornings because that's what, orthodontics calls for sometimes. It's fun. I'm not stressed out. I don't have, a quadrant full of fillings to place upside down, it's just, it's lively and it's fast moving, it's fast paced, and patients are happy when they come in and out, things like that. So I think it really does add to the nature, And another thing is that with staff, I feel like when I'm hiring, it's been in this environment, since the pandemic, it's been very difficult to retain and hire new staff. I know that just from talking to my colleagues and things like that. And we've had some turnover also, but it's been easier to hire on younger staff, and not always younger, just, staff in general, because they think it's cool, they think it's fun. And you obviously are an energetic practice that's taking care of everything, basically, and they like that. And so especially hiring the pre-dental interns and people that are wanting to go to dental school, and newly graduated people, they're all very excited to go into a practice that has orthodontics. Because I've only had the ortho lens in front of me because I started it so early. But I had none of that in dental school, so I can compare it to my years in dental school. Everything was so compartmentalized in dental school, right? So everything was like, this is the pros department, this is the ortho department, you only go here for that, and then they send it back to you, right? And so that's how I learned. But then when I started incorporating into my ortho, into my daily practice, everything is connected. And as a general dentist, everything is connected. Right? And so it just fits right in. And so, yes, before I do, when we're treatment planning, before I do anything, you always are thinking whether the ortho works for this patient to make their case outcomes better, or maybe we can skip that and maybe we can just go straight to restorative. But yeah, I've only seen it this way. And I think it's the best way because you're very comprehensive. You haven't skipped over anything, right? And some people, like I said, may think you're crazy for recommending doing a little bit of aligners or something before you do the restorative, but they really appreciate that you saw the problem and appreciate that you told them what can be done about it, and then appreciate you telling them that what will happen if you don't do that treatment. So then at least they feel very informed. Right, and it's very, they feel just more in control, right? And they just are so thankful to you that you have even just brought it up.
Does that help build trust between you and your patients as well?
Oh yeah, and I tell them all the time, like, here's the thing, my practice, we're very honest. That is one of the things that we pride ourselves on, being just honest, and I will recommend treatment when I really think it's necessary. And so they really, really trust that. And so if I tell them they need orthodontics and that something may happen later in 10 years because if you don't do it, then they trust me, and I'll tell them that I recommend this might happen, but you don't need to do it. Of course you don't need to do it. Or maybe in 2 years we'll talk about it again and then see if you want to do it. Right? So there's no push. It's really just letting them know what you think is the best and then letting them decide what works for them. Oh yeah, I love it. Because I came from a school, UCLA, okay, that is excellent school, obviously. there were 100 of us that graduated, and I was one of the minority who came out and just became a general practitioner, right? And I really wanted that because I wanted to be able to do everything. And I wanted to have the flexibility of learning more in depth about this topic or something like that. So it's been wonderful for me. You know, I'll do my own hygiene if I need to. I will do my own fillings. And then, for example, the case today that we started, where I started the braces on her, she didn't come in to start braces. She had come in initially to do braces, but then I said, hold up, we need to do your exam, your cleanings, all of your fillings. We had 4 quadrants of fillings to do. Lot of busy work for us to do, right, first. And then I said, hey, guess what? Now we get to do ortho. And literally today she signed on and just was like, can you please put brackets on me? Begging me to put brackets on her. So then I had to clear the schedule a little bit and do it, right? So, but who knows better than me what that case needs, because I have done all of those composites and I have seen where all of her plaque builds and I see all of the problems, the rotations and everything, right? And so, you know, it takes a certain kind of doctor, right? But if you're someone who likes to kind of be in control of all of it and really help your patients out, it's the perfect thing. So I'm super excited. She was excited when she left, you know, and then I'm excited because let's see how this turns out. And then later on, when we're done with the ortho, you know, you have these 2 really rotated front teeth. I've just put 2 huge fillings in there to take the cavities out. Put huge fillings in there, but once those are straight, they're not going to be pretty. And I tell her ahead of time, we're going to need to do whitening, we're going to need to do crowns, we're going to need to do veneers on the teeth next to it. And so we're not done. This is a big project for us. It's going to be amazing at the end. And then guarantee you she's going to be my patient. Unless she moves away, she's going to be my patient forever. I'm going to be making retainers for her forever. You know, so it's been really awesome practice builder, honestly, and it's fun. As a new graduate, I didn't know anything about that. I didn't know anything about money. I didn't know anything about economics of a business, of a dental practice. I didn't know that until later, right? And so I went into it not thinking about the business side. The 2 associates that I worked for, I'm sure they were thinking of it because they're the ones that encouraged me to go in and take the series and to bring in a whole new service to the office that previously we were sourcing out, right? And so I'm sure they thought of the economics of it, but at that time I didn't. Until I became, you know, busier, maybe 5 or 10 years in or so, and became the practice owner, I see what it does for the office, and it's amazing. It's just like if you were a practice that did a lot of veneers, it's just like a practice that did a lot of implants. It's just another service that you have patients coming to you, looking for you to provide that service for you and eager to sign on. I'm not begging anybody to do orthodontics. They are literally asking me, can you do it for me?
Yeah.
Mm-hmm. I would say there's probably been an uptick in the aligner cases just because of the ability to treat those patients more remotely. We did start implementing Zoom calls, Zoom appointments, or FaceTime, whatever the patient could do, and we have more patients now that are out of state, which is really great, and it really works with the aligners. It really, I mean, if you have someone that's diligent, obviously, and compliant, and wears their aligners, they are taking care of things themselves, and then you are able to gather a lot of information from just seeing them through Zoom. So that's been really awesome. So I like to tell all the doctors in seminars that it all starts with, you know, gathering your records and doing that initial diagnosis, right? You really have to understand what's going on in the case. What's going on, what are the skeletal problems, what are the dental problems, what are the facial imbalances that you want to fix, and set that all up and document it all really well and really make sure you know what the patient wants versus what you want, because you guys have to agree in that sense, right? And so you have your chief complaint, you have what they want to get fixed, and you have that all set up as a plan in the beginning. Then you can set up your fixed or your aligner case. And then as the patients come in throughout the treatment, then you always go back and reference that. So I always have notes on the side because you see so many patients, it's really easy to forget where you're supposed to be at with this case and what their initial complaint was and what your goals were. So I always have that handy So you might need to pull up your SmileStream file, you might need to pull up your ClearCorrect or Invisalign portal, you might need to have your charts open in front of you when you see them to see where you started and how far you've come. And then from there, then you need to be reactive, right? And just be able to see, okay, is this case tracking? Are we following along? Are we progressing? Do we need to take a step back, or do we need to change the plan, right? So, but it does all start with that your initial steps, and you just have to remind yourself, every time what you're working towards. When you're taking, for example, let's say in the aligner course, and we talk about how to talk to the lab for the diagnosis, right? And we'll make notes to the lab, and we'll say something like, very commonly we want expansion in the upper posteriors, right? And we want to add in 15 degrees of labial root torque. So you're going to hear that all the time. You're going to say it in all of your cases. Well, go back and look at the cases where you didn't do that, right? And that is where you're really going to learn, right? And so yes, of course, we're going to teach you, of course, to write that in, but then maybe you left that off, right? And then you're having trouble at the end, and you feel like you have to go back and you're troubleshooting, right? And you're looking, oh, my lingual cusps are hanging down and I did expansion. Oh, but I forgot to tell the lab to add in that labial root torque. So that's where that learning comes in, and that's why we're always telling our doctors to start the cases, do them now, set them up as we suggest, and then see if you forgot and you left something off. Okay, are you ending up troubleshooting at the end? And then, oh, what did I forget, right? And so that's where the learning comes in, and it's just all about just getting the case going and just going for it. And then you can always go back, and you always have us to help you out. If you need to shoot a picture, hey, this isn't tracking, something's going on here. Let's go back and look at your initial setup. Did we forget something? Did we leave something off? Or is the patient, is there just extra skeletal resistance? It's just a more difficult case. Maybe things just aren't going to proceed as normally they would on this case versus the other case. When I first started with the comprehensive fix series, that was, I think, 18 months or something, right? I think I started 35 cases, which is a lot. I was lucky, I will tell you that, because I was in a busy general dentist. Actually, at that time, I think I was working in 2 or 3 practices, and they would refer me their ortho, which is very lucky, right? And so I had the opportunity to start a lot of cases. But even if you're doing 1 a month, maybe you're doing 1 every other month, you're still going to get that experience. So take advantage of the time that you're in the fix series or the aligner series, and just take in what you can, absorb what you can on the weekends, and then take it back to your practice and start looking for cases. And just throw it out there. Even someone who's 65 or 70 and they have healthy teeth and healthy gums, but they never thought they could align their teeth, make a suggestion to them, and you're going to find lots of patients that want your services. I understand that I was probably a little abnormal because I was so gung-ho about the ortho and so not timid about it, and just jumped into it and did so many cases during my instructor course, or I'm sorry, the basic series. And I know some doctors might have started a couple, so my advice, if you graduate, would be to take your certificate that you get from POS, right, with the gold label, the gold symbol on it, and make it a huge deal. Go get it matted, go get it framed, and hang it up in your waiting room, and let everybody know, right? Post it online, whatever, make it a big deal. Tell your staff, show everyone what you've accomplished. And I have mine double matted. You see that, right? My aligner and my fixed ones. I have those double matted in the front. And just be excited about it, and just don't worry, right? Just get everything set up, get all your equipment going, get your system in place in order to take your records, and just start talking about it. And I'll tell you that my staff loves it. Honestly, from day one, my staff has always wanted to learn more about it. They've always wanted to help me. It is not a struggle. It's fun because it brings in patience and it brings in continuity and, just a livelier atmosphere. It's easier on your body and your mind, right? So it's all good things. So I would just say bring the excitement and just look for patients. And just get going, and then gather your records, and then send them to a mentor, send them to a consultant, send them to 5 different ones that you haven't worked with before, because they're going to send you back case diagnoses, and everyone hits on something that you didn't think of. And all of us instructors explain things in a different way, right? And so you just pick who you want to work with, and maybe you'll stick with somebody, maybe you'll try someone new next time. It is really, really nice to be a general dentist. Again, this is my theme of the whole talk. It's really nice to be a general dentist and do orthodontics because I started practice 2008, right? So it's 14 years. And you know, you have a 12-year-old who's super scared and crying, and then now they're finished college and they are working, and they come in their work clothes and they're still wearing their retainers. You know what I mean? It's such a nice feeling. It's such a good feeling. So I have a case I'm thinking of, this 12-year-old girl who came in. It was the hugest crybaby ever, like the worst crybaby, the worst kind. She was missing 4 laterals, right? So upper 2s, lower 2s, missing those, and had maybe 4 or 5 retained baby teeth in her. Everything is just a jumble and a mess, you know, and it's just crazy. And so Dad is like, please help me, what can you do? It's a complicated case, right? But I did it, I started it. I think it was during my basic series, that first time I took it. And I definitely paired up with somebody, I'm sure. I can't remember which doctor it was, one of the instructors, but they helped me out, held my hand through it. It took maybe 3 or 4 years, because sometimes that's what happens for complicated cases, and if you're starting out and you're not able to troubleshoot really quickly. But we set it up, basically, and she was going to go and get 4, so she's missing the 4 teeth. She was going to go to an oral surgeon and have 4 implants placed. So I sent her to an oral surgeon, and it's funny when you start referring to people, because I was young, that oral surgeon didn't know who I was, and they were really shocked that I did the ortho. And so they actually didn't want to take the case on because they didn't know who was going to be restoring the case, right? And so we kind of had to change the plan a little bit. But I got the biggest compliment from them because they told me that I did a great job setting up the ortho. And it basically was like, who are you? You're not the typical orthodontist that sends me cases, right? And so from there, I just took over the case on my own. And instead of putting in implants, we decided to build out her smile and give her a little bit more protrusion that was going to look really nice on her face. We decided to do bridges. And so that was, 3 years after that, so about 8 years ago or so. And so she comes in every 6 months. She went to university, she went away, she disappeared for a while. She's back now, she has a job. She's like a consultant for something, some job I don't understand. She's doing really well. And she still wears retainers and has her fixed bridges in. And it's so nice, because I just see her face and she looks so balanced, and I'm so glad we made those decisions and all that stuff. And so it's a very silly but warm fuzzies, right? Like, it's nice to go to work and feel like, oh, I'm gonna see her, oh great, and then what's gonna happen, and it's happened before, is she's gonna get married, and then they're gonna have kids, and then she's gonna bring you your kids, and so it's really nice.